Sideline hip shift. Grab a little squishy ball or a foam roller, and let's meet on the wall. You want a wall that's nice and flat. This is pretty much the only spot I have, so I'm gonna meet you here. I'm lying on my right side. I'm gonna place the ball between the legs. In this position, my right side is gonna be slightly elevated up off the ground, almost like I can fit a toy car through here, and my feet are rooted into the wall. Wanna make sure this top foot, especially, I have total foot contact, so that's big toe, inside edge of the heel, and outside edge of the heel. The big thing we're working on here is maintaining that stacked position, so watch that you're not dumping forward at the pelvis. Think about a slight posterior tuck, but without gripping on the glutes. And I'm just essentially moving the hip. So I'm not turning my whole body as I do this. I am just finding that movement at the hip as I go into these hip shifts in a sideline position. So I'm gonna think about inhale, bringing this top knee back in space, and then exhale, just bringing it forward. So the movement is just happening at the hip. We're using the ground as a nice reference. We can breathe into the chest. Inhale as I pull back, and exhale as I come forward. So we're just getting that movement at the hip that we need for walking and just moving throughout our day without compensation. So inhale as I pull back. The ball, mini ball works great. You can also use like a thin foam roller. You don't want something that's too thick. Inhale, and then exhale, come forward. Watching that you're not moving through the whole body. You can keep the chest and the gaze forward. Inhale, and then exhale, slide it back. Inhale back, I prefer, because that kind of inhibits and just like lengthens the tissues on the backside, especially on this left that can be a little grippy and tight. Exhaling forward. If we were to exhale back, that's kind of almost like lifting and contracting. So I like that inhale back, exhale forward. It's a really small movement, just inhaling back and exhale forward. You'll probably feel like something on the back side of this left hip, almost like a stretchy sensation, but also kind of fiery and working. And exhale, come back.